First, Herr Whitmer of Michigan, the governor, Gretchen, tried to blame all of those evil Nazi white supremacist reopen protesters on spreading coronavirus throughout the state. And she did a whole media blitz on this. She went on The View and blamed the reopen protesters. She leaked a phone call that she had with Mike Pence saying, could you please tell those reopen protesters to stop protesting because they're spreading the virus around the state. But after she had that phone call with Mike Pence, what happened is a wise reporter at a press conference asked her, Gretchen, do you actually have any evidence that the reopen protesters are spreading the coronavirus around the state? And she flat out said, and this is in a video on my channel, I've got it documented here, look at the Gretchen Watch playlist. She actually said, no, I don't have data. Why would I have data when I'm making outrageous claims about the activities of citizens in my state of whom I govern? Why would I have data to make outrageous claims about them spreading the virus around the state? So she didn't have data to support that. And then a couple weeks ago, and this is also in a video documented on this channel, we got this news. Michigan declined nursing home leaders' idea to put COVID-19 patients in vacant centers. Now, I'm not going to rehash the whole video that I've already made on this, but let's just do a little refresher, shall we? This is from the Detroit News. 3 days after the confirmation of Michigan's first COVID-19 cases, the state's Nursing Home Association leader recommended in a letter to Governor Gretchen Whitmer's administration that empty facilities should be used as quarantine centers to avoid widespread infection. But state officials declined the suggestion of Melissa Samuel, president and CEO of the Healthcare Association of Michigan, and instead set up a system in which infected residents are cared for in isolated areas of nursing homes separate from the virus. So what they did, and let me just make this, hopefully a little bit bigger so we can actually see the letter, is on March 13th, long time ago, Melissa Samuel sent a letter to Gretchen Whitmer with a number of recommendations. We're not going to go through all of them, but let's just look at this one. Mitigating an outbreak. Allow for the use of empty, vacant, and new and unlicensed facilities as quarantine centers to avoid widespread infections inside of nursing home facilities. This was recommended to her. This was on her desk, but she ignored it. And what was the result of her ignoring it? As of Monday, the state reported 1,947 deaths among individuals who lived in nursing home facilities and 20 deaths among the staff. The tallies represented more than 1/3 of the statewide death toll at that point. Overall, 2/3 of Michigan's COVID-19 deaths have been individuals 70 years or older, according to state data. So Gretchen sounds like she's in a little bit of trouble there. I mean, this is basically saying that this accounted for an awful lot of deaths in the state of Michigan because she flat ignored advice from the Healthcare Association of Michigan not to house these patients in nursing homes. And this makes sense to anyone that has a brain, right? If you have the most vulnerable population of people, senior citizens in nursing home facilities, but that are healthy because they don't have the virus, and then you take a group of people who are sick with the virus and you put them in the same dang building right next to the seniors with the virus, what do you think's going to happen? It's a nursing home, man. I don't care if you put them in an isolated unit. These people, seniors are old. They wander around. They don't know where they are. Look at Joe Biden. Doesn't even know what state he's in half the time. What did you think was going to happen when you put 6 people right next to the healthy people in the same damn building? They had options, they had new facilities, they had vacant facilities, they had the recommendation of the Healthcare Association of Michigan not to do this, and they chose to do it anyway. So now Gretchen's in, and she's in a little bit of a pinch, right? She's got to find another deflection. She tried deflecting to the reopen protesters, that didn't work. Now she's got this story in the Detroit News basically saying she made a bad decision that cost 1,947 people their deaths, probably. So what is she going to do? What excuse is Gretchen going to fall back on? You all know where I'm going with this. You know what she's going to say. What excuse is she going to use? Racism! 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 That's right. Racism is now the reason there have been so many coronavirus deaths. See, I got a lot of emails today. I got a lot of emails from people in Michigan who've been watching my videos on the Gretchen Watch coverage, and they said, Carlin, did you see the press conference in which Gretchen Whitmer just called all healthcare professionals in Michigan racist? And I said, no, I did not see that press conference, but thank you to alerting me. Listen, this is like, we shouldn't be surprised. Let's just say this. We should not be surprised. Let's read what Gretchen's doing. This is from WXYZ in Detroit. New directive requires healthcare professionals to undergo implicit bias training in Michigan. Whitmer. The goal is to improve equity across Michigan's healthcare system. Governor Gretchen Whitmer has signed an executive directive requiring Michigan healthcare professionals to undergo implicit bias training to help reduce racial and other disparities in delivery of medical services. The measure directs the Department of Licensing and Regulatory Affairs to begin developing rules that will require implicit bias training as part of the knowledge and skills necessary for licensure, registration, and renewal of licenses and registrations of mental health professionals in the state. In order to be licensed to practice in Michigan, you have to go through training now to make sure that you're not racist. That's what this is saying. Every single healthcare person is going to have to go through the indoctrination, white fragility training just to make sure that you're not racist. This is nuts. As of July 5th, Black Michiganders represented 14% of the state's population, but 40% of confirmed COVID-19 deaths in which the race of the patient was known. And that's probably a pretty important point. In which the race of the patient was known. According to the state, COVID-19 is over 4 times more prevalent in Black Michiganders than among white Michiganders. You notice how she's instantly deflected the fact that 2,000 people from nursing homes where Gretchen chose to house sick patients, 2,000 people from those homes have died. Probably as a result of Gretchen's decision to house sick patients right next to healthy people. Like, it makes no sense, but we can always fall back on racism as an excuse. Everything is about race. Implicit bias training was one of the recommendations made by the Michigan Coronavirus Task Force on racial disparities. So, apparently she set up an entire task force on racial disparities. The Michigan Coronavirus Task Force on racial disparities. Why would you even... Listen... Talk about confirmation bias, right? Why would you even set up a task force, a coronavirus task force on racial disparities? Why would that even occur to you? Which Governor Whitmer created in response to the devastating and disproportionate impact the pandemic has had on communities of color. I'm sure this didn't overlap with the Black Lives Matter protests that Gretchen was out there arm in arm, walking with the protesters after she tried to blame the reopened protesters for spreading the virus around the state and called them racist and white supremacists on national television. After she did that, she was out there arm in arm with those Black Lives Matter protesters. I'm sure this has no connection to the fact that all of a sudden protest in Michigan became acceptable when it was for Gretchen approved topics. There's no doubt that our frontline healthcare workers, like doctors and nurses, have been the real heroes of this crisis, putting their lives on the line for us every day, said Governor Whitmer. Watch as she's now about to call those same healthcare workers racist. COVID-19 has had a disproportionate impact on people of color due to a variety of factors, and we must do everything we can to address this disparity. The evidence shows that training in implicit bias can make a positive difference, so today we are taking action to help improve racial equity across Michigan's healthcare system. That's why my staff has begun this kind of training, and every member of my team, including me, will complete this type of training on an annual basis. So now it's not only a one-time training that people have to suffer through, but, usually one-time training you can suffer through it, put on your big boy pants, like be an adult, go to the training, meditate or do whatever you want to do during it, and then go home at the end of the day and take a shower and wash all that crazy indoctrination material off. But no. For Gretchen's staff, this is now going to be an annual exercise of indoctrination. The health disparities highlighted during the coronavirus pandemic have made it clear there is more work to do to ensure people of color have the same access to the same quality of healthcare as everyone else. By providing awareness to healthcare workers on how to recognize and mitigate implicit bias, we can help them to carry out their mission of providing the best healthcare to every patient they serve. This is honestly saying that healthcare workers in Michigan are racist, and that's why there's a disparity. Because it couldn't be any other answer. It couldn't be the fact there might be discrepancies in terms of poverty, and people of color may be more likely to live in poverty, and those areas are more likely to be impacted by COVID-19. I don't know. I'm just making that up, but I can see that being actually a far more reasonable answer than healthcare workers are racist, because if you link it to poverty, then there are things you can put in place. There are measures you can put in place that are probably going to be far more beneficial to the people living in that experience than racism training for healthcare workers. The National Healthcare Disparities Report concluded that white patients received a higher quality than Black, Hispanic, Indigenous, and Asian Americans. According to the state, people of color face more barriers to accessing healthcare than white people and are generally less satisfied with those interactions with their healthcare providers. I mean, I can't take the satisfaction thing. I'm going to take the satisfaction thing and put it aside. Obviously, I don't have the data in front of me. But if we're talking about access to healthcare, if access to healthcare is the problem, then how is racism training for healthcare professionals going to solve that? It's not. And there's also a question of, like, who's going to provide this training? Are the healthcare professionals going to get it on their own? Can they go and choose which trainer they want to do their implicit bias training? Or is the state going to mandate what training they have to go to? And is the state, or better question, are the taxpayers of Michigan going to pay for that training? Someone's got to pay for it. Where is it coming from? There is no question that our healthcare workers have risked their own lives and saved countless others during the COVID pandemic, says a doctor in the Michigan Department of Health and Human Services. But the fact is that implicit bias exists, and studies show that it can have an impact on health outcomes. Every healthcare professional should be trained in implicit bias so that we can make sure everyone, regardless of their race and ethnicity, has access to the highest quality healthcare. Listen, I am completely in favor of people of everyone of every race, every ethnicity, every gender, every orientation, all the things. I'm completely in favor of everyone having access to high quality healthcare. This is why I rag on conservatives so much who don't have a healthcare plan, and no, saying the government just shouldn't be involved in healthcare is not a plan, conservatives. We're going to have that argument another time. But, big picture, I'm completely in favor of everyone having access to higher quality healthcare. Is implicit bias training going to fix that problem? What evidence do we have that implicit bias training required for licensure in the state of Michigan is going to fix that problem? What evidence is there that if all the healthcare workers had just had this implicit bias training, there'd be less deaths in Michigan? And maybe even most importantly, Gretchen, how would this have prevented the deaths of the 1,947 people that died in nursing homes because you housed sick patients there? How would this have prevented their deaths? How would that have given them higher access to higher quality healthcare? How would that have impacted that? The answer is it wouldn't, because all of this is deflection. It's just deflection. This is not meant to solve problems. This is meant to deflect from the fact that Gretchen had information presented to her in March. She ignored it, and first she tried to blame the Reopen protesters, and that didn't work, and then she had to protest with the Black Lives Matter protesters to show that she's woke, and so then she lost that excuse, and now she's deflected onto another excuse: racism. Racism. Listen, I truly wish we could have an actual conversation about actual racism in this country and what to do to create more access to opportunity for everyone. I wish that was the case. Obviously, we're not there yet. Listen, folks, if you like my content, if you enjoy what I'm doing, even if it pisses you off, just like this one does, please consider subscribing to my channel, giving it a thumbs up, turning on those notifications, all that good stuff. If you want to follow me on social media, follow me on Parler. I really want to get the hell off Twitter. All the information is in the little box right under me. And also, if you join my locals community, you can watch all these videos ad-free, so you won't have to be annoyed by those stupid ads that Google puts, well, I guess Google and YouTube are the same thing, that they put in those videos. So you can join my locals, watch videos ad-free, and find me on Parler, where I'm having way more substantive interactions than Twitter, because Twitter sucks. Because just like in Michigan, everything on Twitter is about all race, all the time. That is the only answer to anything. Whatever.